So I'm going to go here into the need to measure impact, but maybe before I do that, the idea we have is that in this workshop, we're going to present one key performance indicator in detail and one socio-economic indicator in detail. But each time we're going to run this workshop often, we're going to focus on different indicators. And our plan is that over time, we'll build up a whole curriculum of the different indicators for the community. So I think this will become a really great resource. And I'll just say that with the screen sharing, I may not see any questions or anything. So maybe Gleb or Laurence, if there's any questions that need to be addressed immediately, let me know. So there is a need to measure the impact of imaging facilities and imaging scientists working in these facilities, because a lot of the community don't really understand the role that we have and the role that we have in advancing science. And one thing I just wanted to mention at the beginning, because you'll notice in some of our slides, we use the term scientific platform. And I just wanted to say how important the language is. So in Canada, we have the Canadian Network of Scientific Platforms that oversees all research infrastructure facilities. We're really spanning from engineering to health sciences. And we built this group so that we would have a bigger voice to the stakeholders, funders, and policymakers. And we spent a lot of time choosing our name. And the language of scientific platform and platform scientists seem to really convey well that these groups are accelerating science, and that it's a platform that lifts up all researchers across all fields. And I think Bioimaging UK and the Chan Zuckerberg Initiative have both been really great at also using this term imaging scientist and really promoting how essential imaging scientists are for the community. So initial discussions started with global bioimaging so we could put an international perspective on the topic of impact. And we also wanted to push a bottom-up approach from the community that was really aligned with the mission of scientific platforms or imaging facilities. And Laurence and I had an opportunity to gain funding from the Canadian Natural Sciences and Engineering Research Council to study the impact of scientific platforms on research success. And this was a 1 year of funding that happened to happen in parallel with global bioimaging forming an impact group. So the timing was very good. We'll go to the next slide. So the first thing that's really important is to understand the imaging facility's vision, mission, and values, and why you're measuring the impact has to be aligned with that. So there is a need to focus on the infrastructure and the people. So financial stability is important and it's part of the equation, but it really shouldn't be the main mission of an academic facility. And the indicators you want to measure also need to be tailored for each facility, and they may not align well with classical indicators like those that are used for research labs or principal investigators' impact. And what works for one facility may not work for another, so there's not really kind of a one-size-fits-all that will work in every situation. So for our NSERC project, we used indirect measurements like interviews, qualitative indicators like impressions from users that were gathered through surveys, and quantitative indicators such as the number of labs using a facility. And as I mentioned, it's important that these indicators are measured to demonstrate the impact of the facility in a way that's aligned with the facility mission, but also aligned with the mission, values, and vision of the stakeholders that you're trying to communicate with. For example, an institution may want to know how many labs are using the facility, while a government ministry may be more interested in how many students were trained and found related jobs after they graduated. Next slide. So I think the focus of the next period of time in this workshop will be how do we measure impact? And I'm going to actually start with this Einstein quote at the bottom that Laurence found, which I think really frames things well. Many of the things you can count don't count, and many of the things you can't count do count. And I think this is definitely one of the things we struggle with imaging facilities, in that we have a tremendous impact on a lot of projects, but a lot of times what we do is hard to measure because it's so distributed throughout so many different projects and research groups. So we want to explore some ideas through this workshop and through our discussions. So how do we measure impact? So specific indicators need to be chosen, and as I mentioned, they need to reflect the facility and stakeholder vision, mission, and values. And they have to be placed in the context of a story. So you really want to have the impact in the frame of the story of the facility and the projects and the success stories. And we don't really want the measurements to become the story itself. It's good to measure strengths, but also weaknesses and gaps. So we want to showcase our success stories, but we also want to identify areas for improvement and hopefully propose solutions that could improve the situation. And it's important that the goal is not to compare facilities. So it's not meant to be, measuring the same thing across all different institutions or even within the same institution and compare the facilities. But it's more important if we can measure these indicators over time and measure the evolution of an imaging facility. So the expectations and outcomes will depend on the life cycle of the facility, and they may be very different for a facility that's new and just being established versus one that has been established for a long time. And we need to design and choose those indicators well so that they can be tracked over time.